Hello and welcome everyone. My name is Renee Garrett and I am your speech therapy PD podcast host for Brainstorms, functional neuro-rehab for SLPs. Before we get started, we have a few items to alert you to. Each episode is 60 minutes and will be offered for zero point 0.1 ASHA CEU. Here are the financial and non-financial disclosures. Nancy Horowitz Bertsch receives an honorarium from Speech Therapy PD as a presenter for this podcast. She is also an online course author for Northern Speech Services. Nancy has no relevant non-financial disclosures. My financial disclosures are that I am a paid employee of a private consulting firm in the Commonwealth of Virginia, as well as an adjunct faculty instructor for both James Madison University and Old Dominion University. As the host of this podcast and other webinars on speech therapy PD, I do receive financial reimbursement. My non-financial disclosure is that I'm the secretary for the Communication Disorders Foundation of Virginia. Now, without further ado, we welcome our guest, Nancy Horowitz Bertsch, MA, CCC, SLP, who is a practicing SLP with over 40 years experience working with adults with neurogenic communication disorders, including TBI. Nancy worked across all practice settings, including hospitals, private practice, home health, telehealth, and as a department director for 2 hospitals. Nancy is presented nationally at ASHA and is a graduate of the Leadership Development Program. She served as a peer reviewer for the TBI committee for the ASHA convention and is the founder and director of Well Together Neuro-Rehab Group. Nancy is a contributing author for California Speech Hearing Association magazine and a presenter for California Speech Hearing Association, Arizona Speech Arizona Speech Language Hearing Association, and Colorado Speech Language Hearing Association. Additionally, Nancy has presented several oral seminars and posters. She is a CEU online course author at Northern Speech Services. Welcome, Nancy, and thank you for being here with us.
Hi, thank you very much. And I'm sure you heard my pup who's going to let his voice be known every once in a
That's
while.
okay. That's okay. So we have an interesting story of how we met. I don't know if you want to take the reins or I can explain that.
Well, go ahead, start, and I'll go ahead and throw in my side of it.
Okay, that sounds good. So I presented a course on post-concussion syndrome and CTE at the ASHA convention in Seattle in December of 2024. And Nancy happened to attend and was so gracious to share her story with me. And my colleagues slash friends that were in the audience ran out afterwards and got her and said, "Hey, you should be on the podcast. You'd be a great guest to tell your story," because as a practicing SLP with this background, I really wasn't even aware of until we started collaborating on this talk. Um, you have this unique perspective that you bring to the table that's different from our average everyday person who sustains a concussion or a mild TBI.
So yes, and I don't know if you said that in about the CTE, but and I presented in ASHA in 2013 on CTE. I had a football player who walked in my office and said, "I think I have this."
Wow.
And a lot of what we worked on was what we do with executive function problems and memory problems. And so there it was. You were talking about it, and it was like being home. and I walked out of your seminar going, I think I should be on her seminar. I should be on her podcast. And all of a sudden I hear somebody going, "Ma'am, ma'am."
Oh, good. So we have the same story, and we didn't even rehearse this, so that's
We
good
we didn't.
news.
We're on the same wavelength, but yeah, it's unfortunate for me that I came by this next piece of expertise of self-awareness, of knowing what goes on from my point of view, but I did. So here I am.
Yeah, so let's talk about that. So you had a fall, um, Was the fall like usually a fall is an accident, but was it something unexpected or did you trip over something or were you doing like I do, getting up in the middle of the night to go to the bathroom and not turning lights on? How did the fall
Always
happen?
turn your lights on. Um, the irony of it is that I'm 74 now, and at the time of the fall I was 73, and I had been working per diem at a hospital, a local hospital, and I was just done. I just said, "What am I doing here? It's let the youngins do it." And go. I went through COVID and everything, and so my formal resignation took place on Tuesday, and on Friday I was back in the ER as a
Oh,
patient.
wow.
So couldn't get away from that place. And so I was walking. I was and with my dog, and he is not a large dog. He's about 30 pounds, and in a familiar place. We were walking down the street. On the sidewalk was a little bit like that, bumpy all over like that. And I after several days, I woke up and I had the memory came back is that my knee buckled, and I have a little bit of arthritis in my knee. My knee buckled, and I failed to compensate my right foot enough, and it instead of stepping up, it went like that, and
Mm.
down I went, and I was holding the leash. I didn't put my hands out to catch myself. Which was remarkable. I don't know why that happened. And literally like in a cartoon, splat, went down, and my whole face is was brushed, I guess.
Oh, wow. Did you have facial fractures?
I had no fractures. And so I was lucky about that. And but I can't see them in here, but I had scars, big deep.
Hmm.
I mean, I have some horrible pictures, and um yeah, it was pretty bad. I was scar My whole face was scarred up.
So you had some pretty deep scratches, contusions,
Yeah,
bruising.
I walked out with 4 stitches and a diagnosis of concussion, and that you'll be okay in a few days or a week or so.
You'll be okay in a few days. And you're thinking, yeah, okay, because I have this background. And did you
So
share that or did they know you in the emergency room
they
from
they
working
they
there?
actually didn't. There's so many different people. They didn't know me, but my son-in-law had the classic joke of, "What did the other guy look like?" As far as how beaten up I looked.
Oh, wow.
Yeah,
Did you lose consciousness?
I did not lose consciousness.
Okay.
And with mild concussions, they do grade that as that's a classic question, and some say zero to 30 minutes is a mild concussion, but yeah, I have memory loss,
Mm-hmm.
so maybe I did. I mean, I don't. I remember going down, and I remember sitting up, and I remember some guy picking me up off the street and being pretty bloody. And
Wow. And is that who helped you get to the hospital or did you call your family?
uh, I he just the first person came by, and the dog barked and scared him away, and the second person jumped out of his car and said, "Here, let me help you," and he gave me a tissue or something to wipe my face, and I kept saying to him, "I just live down the street. If you just help me up, I can walk down the street. I can go home and get some help." And he goes, "Lady, you're not going anywhere." And all of a sudden I just kind of had to sit down, and he said something to me that I thought was funny in retrospect. He said, "Do you have anybody to call?" And I just had it hadn't even occurred to me that I would call somebody. I was so stunned and in the moment.
Mm-hmm.
And so I didn't call a neighbor, and she came and got me and took me to the hospital right away.
Okay. So there wasn't a huge gap in time, like you didn't go home and go to bed and wait till the next day like a lot of our patients do.
Right. No, I couldn't do that again because my face, I was bleeding. It was dripping down my face.
Oh, gotcha.
Facial injuries, there's a lot of blood.
Right.
Yeah.
Yeah. So you needed to go get the medical attention for that. So you mentioned the memory issues. What about other symptoms that you've had, maybe more immediate ones and then things that have faded?
Yeah. So I was reading last night, kind of prepping for it, and I forgot one that was pretty consistent, and I called it brain pressure. And it
Okay.
seems to be that the brain, it would hurt. It wouldn't hurt. It just felt like a pushing on my skull. It felt
Okay.
if and I noticed that happened more when I was nervous or more when I was overloaded, sensory overload, and or fatigued. And so if I really go back to look at things, fatigue was a salient feature of the whole picture. I slept most of February,
Wow.
and I would have to do something. I mean, I actually went back to work 2 weeks later, and I would have a session, and then I'd sleep for 2 hours. So anything I had to do, I had to sleep. And so that was it. Word finding aphasia. Uh, my doctor told me I wasn't aphasic, and I said I most certainly am.
If they even knew what it was,
Right.
that'd be great.
Well, the thing of it is people are used to seeing aphasia as being word finding problems or not being able to get your words out, etc. But mine were upper level. I
Mm-hmm.
mean, I was fluent and then I wasn't. And
Right.
I had funny little word errors, and it wasn't. I mean, I could get all of my needs met and all of my thoughts out. They just did it in a funny way sometimes.
Did you find that that was the case also when you were more fatigued or having the sensory overload, as you mentioned?
Yes, absolutely, absolutely.
So when you're describing sensory overload, was it the typical like hyperacusis and photophobia, or was it other things as well?
Um, I don't wasn't that sensitive to light,
Mm-hmm.
and well, let me describe walking into the California Speech and Hearing Association's exhibit hall a month later,
Okay.
and it was like a whirlwind, a merry-go-round of color, and and hazy, like fading in and out, and the noises were made my head just the pressure just push on me, my skull. It was it was so overwhelming. I had to sit down eventually, of course, and kind of regroup. But so there were variants of that. Of course, I was home mostly, and so it was quiet at home. So I didn't have those challenges. It was when I went out, and I hardly went out.
Yeah, but even returning to things like walking the dog, did you do that pretty immediately?
No, it took me a few weeks. And there was a fear of falling. I mean, in fact, I still have a fear of falling. And
Oh,
and
I'm sure I would too. I think that's pretty
yeah, and
valid. Especially I know our neighborhood, the sidewalks are very similar once you get out on the more of the main road that goes in and out of several neighborhoods. We have a big library out there, and there's a spot. Then they used to have it marked with like orange spray paint, but over the years it's worn off, and so now. My husband actually had a fall when he was running out there a couple summers ago. He tripped and he knew it was there, but it's hard to judge when you're in the moment of an activity, right? You know
Hmm.
it's there, but sometimes you misjudge the placement of your foot, and the next thing you know, you're on the ground. So,
Yeah, yeah. My city is the same way with ups and downs. And somebody said, "Why don't you sue the city?" And it's like, how could you? It's all over. And I was walking my dog, and I don't think that my dog pulled me. Um, we've gone over the story over and over again. My son-in-law thinks he did, and but it, he's not strong enough to pull me off balance anyway.
gotcha.
Yeah, so the foot, I'm pretty sure the foot grabbed it and fell like that.
So at what point did you feel like these symptoms, because we know that with as the doctors will say, a regular concussion, a regular concussion symptoms should resolve in 2 to 4 weeks, right? So what, so they say. So at what point did you start to be more concerned and worried that, you're past that 4 week, or even we could go be generous and say 6 week mark, and you're still having what kind of symptoms?
Word finding, memory loss,
Hmm.
fatigue, depression
Okay.
really set in. Um, Fear of falling, proprioceptive issues. I said fatigue, didn't I? Over and over again,
Yes.
fatigue. That was the big one. I was sleeping. I slept the whole month. For 4 weeks, I slept. And sometimes I couldn't put things together. I couldn't grab the thoughts and process them together. My working memory was a big one for me, in that I would look at a date and I would go, okay, March 3rd, and then I'd come to type it and I'd write May 6th, and I'd look at it and it looked fine to me. Okay, that's good. Next. It just wouldn't process. And I had so numbers, and I still have to watch myself. I still have trouble with numbers, days and numbers that way. Um, Not getting subtleties of humor, or getting mm, the semantic undertones of meaning of communication. So
Hmm.
linear thought more so, lots of times.
So difficulty with, you said humor and maybe sarcasm.
Thank you for saying that. It was, yeah, sarcasm. Like when the son said, when he said, what he looked pretty beat up, mom, what did the other guy look like? I didn't get the joke.
Oh, okay.
What does that mean? And now, of course, I do get it, but
Well, and I think it's helpful for people to understand, because you mentioned your age, and a lot of times, even though we're in the field of communication sciences and disorders, a lot of times people still think that normal aging means you're going to start having some of these symptoms, but that's not who Nancy was prior to this event, correct?
I have a very distinct awareness, and I'll describe it as my life is pre-fall and post-fall, and really the way I function. And even now I feel like I'm being hesitant. It might be nerves from being on here, but also it's how I am somewhat hesitant now, where I wasn't before. I was quite articulate, especially in talking about my stuff. and
Mm-hmm.
and I was one way, and then I wasn't. Certainly with normal aging and COVID, the pandemic, the isolation made a lot of us have some word finding problems, or not being so articulate and so fluid. And but I was functioning pretty high,
Hmm.
with
Well, yeah,
occasional
especially
with
if you were working in the hospital. Oh my
I was
gosh.
working in the hospital just prior to that, and online, and writing and doing different things. I was pretty active, and then all of a sudden I wasn't. And then when I came back to it, started to get active, and I was reviewing my notes. I after about 6 weeks I became pretty social again, and jumping in and doing things, but nonetheless, I had word finding problems. I would forget what I was talking about. I couldn't hold on to thoughts, and that happened. Yeah.
And so when you're thinking about the fatigue, were your sleep patterns also interrupted, or were you just sleeping excessively?
Well, thank you for asking about that. I had both.
Okay.
And I had and the doctor, after about 4 or 6 weeks, changed my medication, because I was pretty depressed. And my girlfriend had I read a text that I had written, and she said, "Nance, why did the doctor change your medication?" And I said, "Because I told him that I wanted to kill myself." And so, it was pretty deep, the depression. And I have I am in my 70s. In my late 60s, I lost my husband, so I'm already having some depression, and the pandemics and the war, and there's other reasons that way. But it got it I knew I was different,
Mm-hmm.
and everything I did to try to make it better, which was sleep and read and write and socialize, wasn't really helping.
Yeah. And I think I mean, first of all, thank you for sharing that because that's not an easy thing to talk about for most people, but it's also something that even if you were struggling with it before, we know that with our patients, this chemical response in the brain changes things. And we know that they're more prone to things like anxiety, sleep disorders, depression, other mental health concerns. And so I appreciate you acknowledging that because it is hard a lot of times for people to say that, particularly for our military community members. Um, we hear that a lot. I think it's gotten better, but athletes is another one that you mentioned early on. Athletes have a hard time with that. They need to really have high trust in the person that they're working with because if that stuff gets out, their career's over, right? And that's their money line. It's difficult for them to admit to that and share that. And we see that across sports, not just professional athletes, but collegiate athletes as well.
So there were secondary effects that happened. So now I'm living with a head injury. I had some premorbid conditions, and I think it's important to talk about those, because that's what the issue is, oh, you'll be fine. You're probably that way anyway. And I'm a cancer survivor. And with that, I take some medication. And with that medication, it causes problems, and therefore they monitor it with more medication, which which was the antidepressant. And then they start increasing the antidepressant, and then I had secondary effects of that. I had a tremor, and it got to the point where I was going like this. and
So like a
and
tardive dyskinesia, but a pretty bad one, pretty intense.
it was a pretty intense. And it's come down now. I think now, if I'm good, I've have been successfully titrating down. But it was ruining my life, and it was making it was making me more depressed, because then
Yeah.
it's because the socialization of it, just talking to people, and then you start shaking, and pretty intense. And I want to share some of the responses about fatigue, because I think the stories that were dangerous are the ones that are more poignant, and why we need speech pathologists there to help us, let us know what's going on, and to monitor things. But um, about 6 weeks out, um, I drove about an hour to a friend's 80th birthday party. And coming home, I realized that I needed to stop and take a break. Um, and on the side of the street, it was a small little town, and on the side of the street, there were cars parallel parked. And I was going to pull into one of them and behind one of them and park and just take a break. And so when I came to do that, my brakes didn't work, and I realized I was getting pretty close to the car that I was going to park in front of, and so I had to pull out and try it again. And so I went up to the next car and I did it, and it happened again. And right as I needed to swerve out, I realized that I wasn't hitting the brakes. I was
Mm,
hitting the accelerator.
wow.
So, yeah, I almost crashed into the car in front of me, and the car on the side had to swerve over. And so, there's all sorts of problems. And my friend at the party said, "I think you should just come home and spend the night with me." And I said, "No, I'm fine. I'm a little fatigued, but I'm not sleepy. I think I can make it."
Yeah,
The
and that
mind,
speaks to executive functions, right?
the exactly, exactly. The mind just couldn't take care of it.
Yeah, and one of the things I think, um, I can't remember if you and I talked about this, but again, with our military members who've sustained blast injuries and come home and they've been told, oh, stay home for 10 days and you can go back to work, and they come home and they need to go pick their kids up from school, and they get in the car and they get halfway to where they're going and they forget not only where they're going, but how to get there. And so I think that's a really good, I hate that that happened to you, but I think it's a really great real life example. And that's a place in which we can learn and, like you said, support. Um, we tend to think of the OT as the person who works on uh, reattempts at driving, but we have a role in that because it's a cognitive load, right?
And cognitive loads are exactly, that's a good word to use. They're exactly what it is. When there's more for me to think about and figure out, that's when I start making poor decisions or not putting it together well, things like that. But what I wanted to before I forget, I want I wanted to talk about the therapy that I wish I would have gotten.
Yeah, that was actually my next thing because we did talk briefly about this. What was the treatment plan for you?
Well, what I realized was that I needed somebody to help regulate me.
Hmm.
I needed, this is all in retrospect, I couldn't do it to myself at the time. While I was in it, I couldn't do it. And I couldn't have somebody monitor me and like, excuse me, when I was doing the therapy for the football player, I insisted that he keep a diary so we could look at what happened and to get himself on a time schedule. Sleep would have been great for that. Get off the computer. Don't watch television. Prepare for sleep the same way every night. Sleep hygiene, and those types of feedback and structure would have been so important for me. And then also helping me to understand that how, I mean, intellectually, I know a cognitive load is going to make me have difficulty functioning. When I got
Hmm.
into the doctor's office, it was a little bit harder for me to talk because I was a little bit nervous of talking to him. And then, but if I went to the grocery store, I just completely fell apart. So different loads did different things. But to really have somebody talk to me about it in real life, I mean, really, intellectual knowledge and experience are two different things. Oh,
Hmm.
this is how this feels. So, um, I think having somebody really enforce with me how important sleep was and to monitor it instead of just sleep constantly,
Mm-hmm.
learn how to get up and do some activities, light activities, not. I was doing a heavy load, I was doing therapy, and then my brain would exhaust.
Mm-hmm.
Excuse me, my throat is. I didn't warm up my voice before I came on.
I've got my water sitting here, so
Yeah. Um, th- okay, so now I've lost my thought.
we were talking about your what you would have liked to have seen for treatment because I think the piece that may be missing for people is that you didn't actually get treatment, correct?
I did not get treatment.
Yeah.
I was
Did you?
my own therapist, but not. I was a crummy
Did,
therapist.
I looked at your resume. I think that's not true. So did but did your physician at any point recommend therapy for you?
Only after I had several times said to him in different sessions that I needed a speech therapist, and that was like one of the times when I said I most certainly am aphasic, and he finally looked at me one day and said, "You need a speech therapist," and it's like, yeah, no kidding. You know?
Wow. How long did that take?
Yeah, I don't know, maybe 4 months, 5 months
Oh
into it.
gosh. Oh
Yeah,
no.
yeah. I really needed, and I was seeing a counselor. I still am seeing a counselor online, and but she doesn't have the expertise that I have,
Mm-hmm.
or that you have, and that our listeners have, to really understand what communication is about,
Right.
and get the subtleties, and see where things fall apart for us, and I just can't overemphasize the issue about fatigue. See, there's my tremor starting. So mind fatigues in different ways, I think.
Mm-hmm.
And it can be for words, it can be for numbers, it can be for thoughts, it can be for doing nonverbal tasks. And it really understanding that and being able to talk about it and identify it when it's happening, and then have a strategy to deal with it. Right? That's
Mm-hmm.
all cognitive function stuff, right? It
Right.
is what's needed, and to accept it,
Mm-hmm.
and for a lot of times it angered me, and it depressed me. It contributed to isolation, social isolation, and that's the big thing. I mean, I was talking about isolation in 2010, saying this is what seniors are having problems with, and we're still talking about it, and they call it the silent epidemic now,
Mm-hmm.
so.
Yeah. So now, you had some SLP treatment, but for how long?
I have not had any SLP treatment other than myself.
Oh,
So I
okay.
have so I have not had any.
No outside therapy. So you therapized yourself.
At some point in time, and I still need a therapist because I still can't monitor myself.
Mm-hmm.
I can talk about it when I need.
Well,
I know
you're
I
all
need this. I don't have anybody holding me accountable to it.
yeah. So you're able to self-identify, but not self-correct necessarily.
Yeah,
Yeah.
I'd say that.
Yeah. It's like the train headed away from the station towards the burning building, if you will.
Look,
You're
there it
you're on this.
goes.
Yeah, there it goes. The train's left the station and we're not getting that back. But I
Yeah.
think again, having these visuals and ways that we can picture what that feels like for someone, I think it helps us as that counseling role that we do have and that education role that we should be taking more ownership of because it empowers the patient. And you've said that without saying it. But I think that's what you were alluding to, is it's empowering for you to be able to identify. But then if you had someone who's backing you up and holding you accountable, then you're being empowered to use those strategies, and you're being empowered to look forward to your recovery.
Look forward to my recovery. I haven't even thought of that concept.
Yeah, when you're 1 year out, right? Almost a year out.
I will be 1 year out. It happened in February. Yeah. I'm
Wow.
almost 1 year out. I hadn't thought about that. People will say to me, "Oh, you're all better." And it's like, oh, yeah. I'm like the walking injured. Although you can see, if you look really close, you can see some scars. But I know I'm not all better. I know I'm not the same Nancy. I know
Yeah.
that. I feel that it's like at a cellular level, or that bruising has occurred, maybe neuron shearing of the axons, and um, things just don't go together the way they used to.
Well, and interestingly enough, and I don't know if this is something that you want to share, but you had testing done, what, about a month ago?
Testing.
Mm-hmm.
What type of testing?
Didn't you have a scan, a CT scan?
Yes, I had, well, in the hospital, I had a CT scan, and of course it showed nothing.
Mm-hmm.
And I kept saying I needed an MRI. Yes, I had an MRI, and it came out normal. And I said, "Well, what's normal?" Did they say normal for my age? I mean, or is there any sort of atrophy going on? And but what I wonder what a PET scan would show.
Yeah.
And I just feel that there's been some bruising that has occurred, and it hasn't completely healed, and sometimes it shows up and sometimes it doesn't.
Yeah. And I think that's fair. That sounds like classic post-concussion syndrome, when the symptoms don't completely disappear, or, that has this little bit more lasting effect on you, which, again, you were very honest and open about that when we met. And I'm grateful that your MRI came back, well, they say negative, which sounds worse than
Yeah,
good.
negative and positive, right?
Yeah, you're positive for a bleed, but you're negative for being normal. I don't that's it's the strange terminology, but I'm grateful for that. But at the same time, I think, does it play into your psyche, in that you it it's a good thing, but it's also not acknowledging that you feel something is not as it was.
Well, yeah, and let's talk about the labels. And I think that
Okay.
this goes across. I mean, I had a student tell me that how hard it was being labeled learning disability,
Mm-hmm.
right? And I didn't say this to her, but you know, how hard it was being labeled mild concussion. It's like, there's nothing mild about it.
Mm-hmm.
And people would just my own personal um self-esteem was, I feel like people think I was making a big deal over something that wasn't such a big deal.
Mm-hmm.
And I didn't have somebody to say to me, "That's right. This is a big deal.
Mm-hmm.
That did really happen. Though your brain is really, really needing to heal. These things did occur." And I didn't have that support system. I mean, I had my family to acknowledge it. They knew it was going on, but they also kind of were going, "Well, how long is this going to take?" They didn't say that, but their nonverbal comments were, "All right, we still got to go help mom."
Yeah, well, and honestly, that makes sense, because they knew you, like you said, this before Nancy and after the fall Nancy. They knew you as before. the I don't like saying geriatric to your face, but if you look at the number of years of life, the medical community would classify you as geriatric, but that's not you're not the typical what we would expect of a 74-year-old, right? You're still a working professional. You're
I was out
presenting.
playing golf the year before I did a zip line in Costa Rica. Yeah, I'm out there, you know.
Love it. Boy, Nancy, it's a good thing we live on two different coasts. We might get into trouble.
I'm not doing that now. The doctor was even like on me about walking the dog because if I fall again, and I go, yeah, yeah, second injury, I know all about it, right? But I
But at
had
the
to get
same
up and
time,
get going. Yeah.
yeah, you've got to stay active because that's one of the reasons for your ability to still work and to still be presenting at national conferences for Pete's sake. It's not like you're just doing one telehealth session a month. You're
Yeah.
doing all of
Yeah.
these things, and that's the thing that's probably, or some of the things that have kept you. You mentioned those things as people age that help, keeping their cognition active, being physically active. Um, I know what the other piece was I wanted to talk about. What about nutrition? Did that play into your recovery at all, or did that discussion come up with your medical team?
Thank you for asking about that. Th- Certainly I have paid attention to nutrition all of my life. And there's all different camps of what's important and what's not important. And we don't need to go into that. Excuse me. But I must say that I use sugar as a drug with my sleep. And I knew that I shouldn't, but I didn't have anybody monitoring me.
So the sweet tooth kicked in and you rolled
Right.
with it.
That contributed to the sleep problems. And then it just it's like a domino effect. And I started gaining weight. And then that contributed to the depression, and the depression just goes on and on and on. It was a circle. And again, um, I think that bringing the concept of nutrition into the whole picture is definitely a counseling role for speech pathologists. We don't need to be experts on it, but we certainly know basics like
Hmm.
that. And and for
Yeah, I
example, I should have hydrated more before I came on the session. All you speechies out there are going, well, she's heating up her vocal folds.
well, and I know for me, I took a just because I was interested in it and I needed an elective to fill a spot when I was the undergrad, and I did take a basic nutrition class, but one of the things it talked about was longevity, brain health. And it was brief, but it talks about, the things that's recommended that you eat or supplements. Like, a lot of people still purport fish oil, but, we know we can, if we're eating fish, we still get that benefit on a regular basis. But it's hard, right? And again, that your regular life sometimes can step into your nutrition and the ways that you're incorporating that into your day, how much you're able to be physically active. Maybe you're not, and then you're eating the same amount, so you see that change. But then when you're looking at, I know when I go to state conference a lot of times, because I'm on the Communication Disorders Foundation board, we have a lot of events. I usually present at my state conference, and I find myself not paying attention to eating well or eating enough or eating regularly. So I might go all day and not eat from the time, I eat something small because I'm not a huge breakfast person. And now it's 4 p.m. and I feel like I'm going to fall on the floor because I'm starving to death. Not to death, but you know what I mean? So when we think about that in terms of someone who's had a concussion, a mild TBI, I still like that word mild, like you said. It doesn't
Nothing
feel very
mild about
mild.
it. Yeah.
Yeah, so if I know that that impacts me on a regular day, we can only imagine how that impacts our patients. And you could even stretch that and say people who don't have access to food or don't have access to quality food. Think about that in your patients who are more prone to falls or who've had a concussion related injury. So yeah, I think I'm with you in that camp.
I think that working in the hospitals, whenever I had a fall patient, the first question I'd come up for me was, why'd they fall?
Hmm. Yeah. And what's the answer for us? A lot of times why our patients fall.
Well, it can be that they're not paying attention. It can be that they're moving too fast. It can be it can be like we just said, their nutrition would be off, their sleep would be
Hmm.
off. They're not paying attention to what's
Yeah.
going on. Sometimes Parkinson's and
Hmm.
at the beginning of Parkinson's will show up that way. And
Yeah.
yeah,
But a lot of times we see that metabolic component, whether they have something like hypokalemia, right? Or their sodium is way too high or their potassium's too high. They've got this um, discrepancy in their metabolic function that's causing now this inattention
right,
and this poor
right,
concentration. And it all does, it ties together. Memory, same thing. They're not, if you can't attend, you're not going to remember.
right,
So it all bundles together.
right. But it's just in my age group and younger, because I've been in this geriatric age group now for almost a decade.
I beg to
that
differ. I don't think you're geriatric at all.
that that people expect us to have our labs off,
True, true.
right? And expect us to premorbid conditions and that's not the head injury. That's because you have hypertension or your sugars are high or your sugars are low or things like that. And I don't have hypertension and my sugars are just fine. And so
Yeah, and you had a random thing happen that again, we do see that in the medical side of what we do. We see that with some patients. They do not have these pre-existing or premorbid conditions. They just had an accidental thing that happened. It could be also from a motor vehicle crash where it's not your fault. We both of us having worked in the TBI community for a long time, a lot of times, you see the statistics on people who are in motor vehicle crashes or motorcycle accidents specifically, and a lot of times the societal um, assumption is that it's their fault. It's the motorcycle driver's fault. And 9 times out of 10 for me, when I worked in inpatient rehab, it wasn't. It wasn't their fault. They were driving home from work, and some idiot decided they were going to make a right-hand turn from the left-hand lane and didn't see them and clipped their motorcycle and almost killed them. So I saw that quite a bit. Or higher speed accidents on the interstate where the person was in the vehicle was trying to pass the person in the motorcycle and clipped the motorcycle and they went off the road and down the hill. So there's a lot of things like that that happen to people that aren't their fault. It's not anything that they chose or not anything that they did wrong.
yeah, combinations. I also just think that there's a subtlety that happens with symptoms that where is the line between having comorbidities, having some problems anyway, and now new problems imposed on top of them, superimposed, and how do they interplay?
Hmm.
Um, and certainly, like I said, I'm a surviving cancer patient, and my comorbidity is that I have a med that affects me to some degree, and so and depression is one of them, and so that well, she's depressed anyway, right? No, wait a minute, right? Mom was handling it. She was doing really, really well. She had this little tiny pill. There goes my see my tremor from the tremors happened with the increase antidepressant
Hmm.
is my observation. the doctor wasn't so sure.
Well, I mean, they do have a ton of research for tardive dyskinesia as a result of antidepressants or anti-anxiety, right?
Cerebellar injuries also. If I had
Mm-hmm.
contra damage and tremors, there's research out there.
Yeah.
Yeah.
Wow. Mm. Well, and you have some exciting things coming up. Do you want to share anything about what's going on with you? Other than
Well,
you being so generous to tell us how you feel and like your experience with the concussion.
well, I'll say that after I went to Kasha last year, I was so driven to tell my story that I put a proposal into ASHA, and it didn't get accepted. And when I went back and read my proposal, I could see how I was so disjointed. I wouldn't have accepted me either. So I rewrote it, and it's more cogent and flows. And I did get accepted to speak at the California Speech and Hearing Association, which is in March. Unfortunately, it is in Pasadena.
I know.
So I'm really just kind of wait and see,
Yeah.
what's going to happen there. And God bless everybody in LA. And but I am putting together a presentation, a PowerPoint on this very topic, but including in it the idea of this silent epidemic of geriatric falls and head injury, and then social isolation, which comes with it as well, because those two together are increasing mortality rates at epidemic levels. And
Right.
and it's my stuff, it's my field, and it is my age group, and we need to be a louder voice, and that's what my paper is, a call to action.
Mm-hmm.
ASHA, if you go to the ASHA website, it says straight out everything and how we can support people with head injuries. Yeah, that's obvious stuff, right? Um, but it's not talking about geriatrics as much. There's not that much information, and or how to reframe looking at a head injury instead of saying,
Mm-hmm.
"Oh, it's level 1, level 2, level 3. Did you lose consciousness? Did you not lose consciousness?" It the, they're looking at the psychological factors, the physiological factors, the neurological factors, and putting that all together, because that's what it is. It's not just one thing. It's not just you're a mild concussion, you'll be better in 2 weeks. Oh, you're geriatric. It might be a little longer, but those symptoms you had anyway.
Yeah, no, and I think it's one of the other questions that I forgot to mention early on. Did they refer you to physical therapy?
Only after I bugged them and bugged them and bugged them, and I haven't gone. And the reason I haven't gone is that the doctor wanted to go through titrating my meds with me, because that was it. We can't do two things at once. I can only do one thing.
Mm-hmm.
So we're doing that, but I am taking yoga, and that
Oh,
has
good.
and that has improved my golf game, and also my balance and my posture, and my self-esteem, because some of the older adults, it's yoga for older adults, but the older adults are in their 30s. Some of those older adults say I rock it,
I bet you do.
but I'm afraid to stand on my head. I don't like I won't I don't want to go down there. I'm so afraid of falling.
No, I feel well, and for me, I had a car accident when I was much younger, and I had whiplash and then occipital neuralgia after. So I'm funny about my head too, and I I get what you say when you say the pressure, because sometimes even now, and gosh, that happened 30 something years ago. I don't know how that's possible since I'm clearly 29, but I don't like the the pressure on my head, it makes me feel funny, and that's the best way that I can describe it. And I've been that way. I was an athlete when I was a kid, and took I didn't really stop doing gymnastics until I was in college, and I was always flipping around, and my head was always upside down. But after that accident happened, I couldn't do it in the same way anymore. It just feels disoriented isn't the right word. I can't ever come up with a word that describes it, but I think when you've had whiplash, I recently learned that and I talked about this at the talk, whiplash and concussion are best friends. They go together. If you get diagnosed with whiplash, you've had a concussion. And I
Right,
never
because
got
you've
diagnosed.
gone back like that. It's a conjugate damage, right?
Exactly.
And it's the pressure for me that is so disorienting,
Hmm.
and yeah, it just really throws me off. It just
Yeah, I can remember that early on, the clouding my thinking was a good way, I guess, for being. It could be, again, I didn't get, no one ever said you had a concussion, but I had terrible migraines for years after that happened. And again, you're young, it's hormonal, or, maybe it's birth control or whatever. But now that I do this and I've learned, I know that what I experienced was probably all those things, and the light bulb didn't go off until I was much older. So, it's something that doesn't always
mm,
mine went away in those terms. Oh, I don't have the concentration or the attention issues, the memory issues, but I did have an instance kind of in the middle of the pandemic where I helped move a patient that was a pretty morbidly obese patient for a modified barium swallow study. And it triggered the occipital neuralgia just because, and it wasn't that I did anything incorrectly, it just was the load that day.
there's a load, yeah.
Yeah, and I did wind up going. The only thing that really helped was the chiropractor. But I mean, again, that we don't think of those things as having lasting effects. We're told that it's supposed to go away, it gets better, you won't see it again. Good luck. Go back to
And
work in 2 weeks.
I think it's a good luck and go back to work in 2 weeks that was overwhelming for me. I did go back to work. I could go back to work, but again, at what cost?
Mm-hmm.
And emotional, psychological, physical, you know. And my doctor had even said, Nancy, if you push now, you're going to pay for it later,
Mm-hmm.
right? I mean, he started telling me that, right? But then one needs to monitor what the word push means.
Well, yeah, especially if you've been a go-getter and a lot of us SLPs are pretty type A or A plus, or some of us are A plus plus. For the most part, we're used to managing our day. We're managing how many other patients' days, right? We're managing our household throughout your lifespan. If you have children, you're managing that.
Yeah, how
You're
did I do that?
exactly, exactly. And so now that you've had this happen, you can. Just think your perspective is so valuable because not only is it helping you kind of move in a different direction from a research perspective, but it's making you more mindful of what our patients truly need.
I think that's that, and for us to be advocates, really strong advocates in the ER room, talk to the nurses, talk to the CNAs, talk to the doctor about how about a referral now? You
Mm-hmm.
know, somebody who can be there and support them and advocate for them and reflect back about what's going on and let them know it's okay
Mm-hmm.
instead of waiting between the doctor visits and trying to explain oneself to a doctor who has 7 minutes to be with you and you can't get the words out.
Mm-hmm.
And we as SLPs have a unique perspective, and we have that valuable time that we get to spend larger blocks of times with our patients, and we know how to listen.
Yeah, we do. Well, I really appreciate you sharing your story, and I appreciate you also coming to my talk, but it was I think that was a meeting that was planned somewhere else because as fate would have it, we wound up in the same place at the same time and we're on two different coasts. And I think there was some intervention there that we didn't have any control
Divine
of.
intervention. I was
Yeah.
jumping off of my chair wanting to go, hey, 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 you're talking about me. Hey, 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 hey. That's me. Wanted to grab that microphone.
You could have been my co-presenter. Maybe we should put that in our back pocket. Maybe that would be a good one, a
That might
co-presenter.
be fun.
That would be fun.
We certainly
Well,
have a lot to share.
yeah. Well, Nancy, I appreciate you so much for joining us. And just again, thank you for being so willing to share your story and also willing to think outside the box and how you can continue to be an advocate for this patient population. And thank you for your body of work because I didn't know that you were like famous, famous.
I'm not famous, and I live in a small town, and people say that, my colleagues will say that, and I go, no, 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 I'm not. But I have put myself out there quite a bit, and I'm glad that I did. Yeah.
Yeah. Well, just keep on keeping on and please stay in touch. We thank you so much for working with us today and for being here.
Thank you.